Caitlin Tips, and today we are going to talk about female circumcision, better known around the world as female genital mutilation or cutting. Before I continue, there is a warning. There is some graphic imaging and some hard to listen to conversation. So if you have some squeamishness, please don't watch. So the importance of knowing about female genital mutilation or female circumcision is that it is a global issue and there is little discussion on this subject. It is a very uncomfortable subject and most people don't feel comfortable talking about it. So over this presentation, we're going to look at what the procedure is, the cultures and religions for the background of the procedure, and how it affects the body in the long term and the short term. So the people that are most affected by this is African tribes such as the Maasai women, Middle Eastern women, and some religious communities including Muslim women, Jewish women, and Christian women. So we see this going from family tradition to preventing infidelity to being a religious practice. So in communities such as the Maasai, it is looked at as a rite of passage into womanhood. And if the procedure is not done, then these women will not be married and they will not bear children. In Muslim communities, Jewish communities, and Christian communities, it is a religious practice and it is to prevent women from cheating on their husbands. It takes away the pleasure of sex for the women, so they will not stray. With that being said, there is no religious text, whether it be the Quran or the Bible or the Torah, that encourages this practice. So there are 3 different types of female circumcision that we see commonly. We have the sunnah, which is the removal of the clitoral hood. Now, this procedure, when done on children and for religious reasons, can cause long-term issues. But sunnah also has medical benefits for some women who have some form of sexual dysfunction. Excision is the complete removal of the clitoris. The clitoris is completely cut off, and this can lead to some health risks for the women, but also does not have as bad effects as infibulation. Excision is the most common form of female circumcision, happening in it's about 80 to 85% of the women that have circumcision done. Infibulation is the removal of all of the exterior tissue and skin, and then the vagina is stitched closed except for a small hole about the size of a pencil. Now, if you see the images down here, you see what it is like before circumcision, and then you see the clitoral excision where they have removed the prepuce and the clitoris. And then infibulation, you see that there is just a small hole and that the vagina has been completely stitched shut. Are insane. The immediate risks include infections and diseases such as HIV, because it is prominent in most of the communities where this happens. And the long-term effects can be anywhere from just having recurrent urinary tract infections and yeast infections to painful sex to stillbirth. So the most common reason that there is a short-term effect is because the procedure is typically done without anesthesia, because it is not done by a medical professional. So it will send the body into shock, and then it can cause issues such as sepsis and extreme pain, and then immediate infection, and again, HIV. In the long term, it can cause issues such as keloids, which is when the body has built up scar tissue around the excision site. You can get fibrosis, you can get cysts. A lot of women have become infertile. You have urine retention because they cannot use the restroom anymore because their holes are stitched closed. And there's many more issues. Now, when you look at obstetrician care for these women, it becomes an issue because they're 30% more likely to have a C-section. And, OBGYN practitioners do not typically know how to treat these women through their pregnancy and through their childbirth in the United States. So it causes greater risk for hemorrhage during childbirth and greater risk for the mother to die. The babies born to women who have undergone type 2 or type 3 are at greater risk of having to be resuscitated or are stillborn. So the conclusion to all of this is the reason that we need to talk about this is so we can make a change. The only way to stop history from repeating itself is to learn on it. And the women who are affected and go through this have spent a lifetime suffering and deserve to be spoken about. That being said, these women have also condemned the use of the word female genital mutilation because it brings light to their culture, saying that they never had a choice, and we are taking away their choice as well. So the only way to change the way things have happened is to inform each other. All right, thank you. Have a good day.